here. I'm Dr. Candice, your board certified pediatrician and kid health expert, and today is the word in the clinic. So today's word in the clinic is safe sleep. And I want to talk to you about how to keep your infant, your child under 1, your newborn, safe while they're sleeping. Hey, Carlos. So that's so important because no one ever thinks that their child could pass away, a healthy baby especially, within the first year of life. We just don't think about that. You know, they are born, they're healthy, everything's going great, and that's not something we want to happen or something we think about. But unfortunately, over 3,000 babies die each year. Some reasons we don't know why they pass, so that's SIDS. But some babies, it's clear that it was a suffocation or strangulation or something like that. But as a whole, these are usually caused by unsafe sleeping situations. And so that's what I want to talk to you about today, because there's no reason to lose a child just because of the sleep environment was unsafe, right? So that's what we're going to go over today, because I want your baby to come home and I want you to do things safe so that they'll make it through, right? All right, so let's get those points out there. I've posted this out so many times on social media. Hey, Jacory, about how to make sure your baby is in a safe sleep environment, but we're going to go through that again. So this is really quick. The ABCs of safe sleep. You want your baby to sleep alone. And that's a big one because parents are sleep deprived. I have 2 kids. I went through this. I have a 2-year-old. Her birthday was yesterday. And sometimes we still struggle with that after we come back from a trip, or if she's not feeling well, she's all in our bed. But the first year of life, especially those first 4 months, it's very dangerous for them to be in the bed with you, okay? And I hear it all the time, and I thought it myself. There's no way I'll roll over on my baby. There's no way I'll get my baby wrapped in a blanket or under a pillow. I'm going to sleep light enough. My maternal instincts won't let that happen, but it happens because you're so sleep deprived, right? And when you fall off, you don't know what's happening with the baby or where their baby is. So don't put the baby in the bed with you. The first A is alone. The baby needs to sleep by themselves, preferably in a crib or a bassinet. Now, we do recommend, the current American Academy of Pediatrics guidelines are that for sleep, safe sleep, are that your baby sleeps in the room with you. So you don't have to worry that they're in a separate room and you're scared all night thinking something will happen to them, especially if your baby's refluxing and coughing and gagging a little bit or spitting up. I know there's a lot of thoughts out there that the baby can choke. So the baby should be right next to your bed in a bassinet or a crib. That way you're close, but you're separated enough in a safe way that you can't roll over on them, or pillows or blankets aren't going to play into their safety, okay? So alone. The B is for on their back. So the baby's alone in their bassinet or crib, right next to your bed, and you place them on their back to sleep. Okay, back to sleep. That's a huge campaign that has saved so many lives and reduced the risk of SIDS and sudden infant death and babies dying in their sleep in the infant period of time. Okay, so on their back. All right. Now, a lot of parents will tell me, well, I don't want to lay him on the back because if he spits up, he's going to strangle. And I know we're thinking about our adult selves. If we choke or throw up or gag at night and we're on our back, we think about aspirating or choking. Hey, Rhonda. Unfortunately, babies are not just little adults, okay? Their anatomy is different. Their gag reflex is protective. Their anatomy with the throat and the esophagus is positioned where it is actually protective for them to be on their back. So I want to dispel that myth. If your baby spits up or has reflux, they still should be on their back because they shouldn't aspirate or choke like you think and die from spitting up. So you don't have to prop them on their side or sleep them on their belly thinking if they do it'll just go on the bed. That's a myth, okay? You want to sleep your baby on their back. That's the safest way to sleep them, okay? Alone in their crib or bassinet on their back, even if they spit up, even if they have reflux. Structurally, it's protective. Their gag reflex will protect them. They won't choke, okay? Now, you're right there, remember? The baby's in the room with you. So if they're choking and gagging and spitting up, you hear it, you get up, you sit them up, you pat them on the back, you're right there. They don't have to be right next to you, right? Okay, so the C is for, so we said alone, on the back, and in their crib. So we've already went through all the points. A, B, C, alone, on their back, and in their crib. You don't have to get a super soft crib. Nothing should be in that crib. No teddy bears, no bumpers. That's a big one. Oh, she'll hit her head. Those, the slates, she'll hit her head or she'll get her foot through there and hurt herself. That really hasn't been shown to happen. Don't worry. It's not so hard that they'll hurt themselves anyway if they bump their heads. But you definitely don't want your baby to wedge themselves between the bumper and suffocate, okay, where they can't move, especially for those very young babies under 4 months. Hey, Rhonda. Hey, Peter. So no bumpers, no teddy bears, no blankets, no pillows. What else is there? Don't put all of that stuff in your baby's bed. They're alone in that crib or bassinet. They're on their back, okay, in that crib, all right, without all of the friends. Now, if your baby's under 3 or 4 months and you're still swaddling them in a thin, breathable blanket, that's fine. But once that baby gets to moving and rolling, you need to take all of that out. They should just be in a onesie, a sleeper onesie. If you're concerned about them being cold, they don't need a pillow. They do just fine with all of that on their back, okay? So I think we went through the ABCs of safe sleep. That's what we're talking about today, how to keep your infant safe while sleeping. And then in the room with you. Those are my points. So this was a quick one today. But I just really want you guys to know that this is real. Like I said, over 3,000 babies a year perish from unsafe sleeping situations. Those are the tips to keep your baby safe on their back, alone, without all the stuff, not in the bed with you, and in a crib on the bassinet, in the room with you the first year of life. That's the safest thing. Also, pacifiers have been shown to protect babies from SIDS. So definitely don't feel guilty about using a pacifier for your baby. Also, don't smoke, don't drink, any of those things. Cigarette smoke has been shown to increase the risk of SIDS. And then if you are if you are impaired in any way with alcohol or drugs or anything like that, that also puts your baby in an unsafe situation. So that's all the more reason why you don't get in the bed after you've been drinking or taking some medicine with your baby. So definitely, some parents may need pain medicine initially, so you definitely want to put your baby in the bed if you're taking something like that, or get your husband or partner or someone to help you with the baby if you're taking something that's making you groggy or sleepy, okay? The other thing I wanted to talk about briefly was just when you're sleep deprived again. Oftentimes I see so many cute pictures of parents or a family member who has the baby on their chest, on the sofa, in a sleeper chair, in the bed, and you fell off to sleep. Those are cute pictures, but it scares me. It's not safe. So many incidences of the baby dropping your arm, the baby rolling on the floor, or the baby wedging in the corner of the arm of the chair between you. And so definitely not safe. As soon as you feel yourself getting very sleepy or nodding off, go ahead and put the baby down in a safe situation. Don't think that you're going to be able to protect that baby once you fall asleep. Try not to do that. We all had that happen. I breastfed. I would feed that baby 2, 3 in the morning, and she'd fall asleep. I'd fall asleep. I'd wake up terrified that I had fallen asleep with her and put her back in her bed. This is not easy. I just want to say that. I'm not judging, because this is not easy. I've gone through it. I've struggled with this. And we just have to try our best. And remember to try to keep them as safe as possible. And try your best to train them early. Hey, Dr. Sharon. Hey, Peter. Train them early to sleep well. So as soon as you bring them home, start these healthy sleep habits, the ABCs of sleep, and you likely will train them to sleep well. Because a baby is more comfortable right on you. They were inside of you. That's how they sleep best. And so when we want to put them in this crib by themselves on their back, that is not what they want to do. They don't like that. That's not comfortable. So there is an element of training there. It's safe for them, so we have to make it happen. All right. So yes, it's hard because that's not what they naturally want to do. All right. That's it.